AI is replacing doctors. That's what everyone is saying right now. And depending on who you ask, it's either the future of medicine or the beginning of the end. But here's the truth. AI is not replacing doctors. It's replacing the work doctors do. And that distinction changes everything. Welcome to Informed and Unfiltered, where we talk about medicine, the good, the bad, and the ugly. I'm Dr. Aisha Rush, and today we're going to break down exactly how AI is already taking over parts of medicine and what that means for physicians, patients, and the future of healthcare. So it's interesting. A colleague and I were talking about this very thing the other day. I began to think about some of the things we spoke about, and that's what prompted me to look more into this. This is not to mention that this very same colleague did a presentation in front of our colleagues at the American College of Obstetricians, and Gynecologists, ACOG for short, 15 years ago, and talked about how telemedicine would be the future. Many of the participants balked at this assertion, but here we are 15 years later. And we're not just dealing with the transition to telemedicine, we're dealing with something bigger, stronger, faster, and that's AI. Interestingly enough, my best friend just started working for Anthropic. And his first day at work, the first thing that he said to me is, "This is so big, it's bigger than we can ever imagine, and it's going fast." There have been several articles dealing with this very subject of AI, and especially AI in medicine. Time magazine actually published an article in March of this year talking about how healthcare is AI's hardest test. Harvard published an article talking about how AI is disrupting medicine and what that means for physicians. PubMed even had an article that talked about how AI will alleviate some of the healthcare shortages. The American Medical Association also weighed in on this topic. So the question everyone is asking is, will AI replace doctors? This is a great question, and one I'm asking too as this area of medicine continues to emerge. So is that the wrong question? Or is the right question, which parts of being a doctor can be automated? Because medicine is not just one job. It's a collection of tasks. And this is just to name a few. It's assessing, diagnosing, it's documenting, interpreting data, communicating, and deciding under pressure. It's also interpreting data to come up with your diagnosis in an effort to treat your patient. And AI doesn't need to replace you. It just needs to replace enough of those tasks to change how many doctors are needed. Let's start with how AI is replacing diagnostic work, because this is where things get uncomfortable. AI is exceptionally good at pattern recognition, data synthesis, probability-based decision-making, and in some cases, it's already outperforming physicians. Think about it. AI doesn't get tired. It doesn't miss subtle patterns. It has access to millions of cases, not just what it's seen in residency. So in fields like radiology, dermatology, pathology, AI can detect cancers earlier, identify abnormalities faster, and in some cases with more accuracy, and flag things a human might overlook. So yes, AI is already replacing parts of diagnostic medicine. Not completely, but enough to change the landscape. So if you want to understand the future of medicine, let's look at radiology, for instance. Radiology is like the canary in the coal mine. Radiologists have spent years doing image interpretation, pattern recognition, reporting findings. That is exactly what AI is built to do. And now, AI can read X-rays, analyze CT scans, detect tumors, faster, and even in some cases, more consistently. Does that mean radiologists disappear? No, but it does mean that we need to look at this a little bit further. There may be fewer radiologists needed. Their roles may shift to oversight. The job itself changes. They may even have to alter and or enhance their skill set to remain relevant and needed. And that should get everyone's attention. For many of us who's been in this field for some time, we've seen the shift from in-house radiologists to remote radiologists that are halfway across the world reading films. We've also seen the upside and the downside to this when you're waiting for hours for your images to be read, when years ago it may take an in-house radiologist 30 minutes to an hour. AI is improving this hurdle at record speed. Now let's talk about something every physician understands: documentation. The notes, the charting, the billing codes, the part of medicine most doctors actually hate. I remember years ago doing my training when I first heard of scribes. Some of you may have heard of them, some of you may not have. Some places had them, some places didn't. But scribes were people that walked around with doctors as they saw their patients to document their assessments, diagnoses, and do some of the billing work. If you had a good scribe, you could see more patients per hour and the notes would be pristine, or at least much better than some of the doctors could do with limited time. I even remember when doctors used to walk around with hand recorders and would send off the cassettes to a transcriptionist that would type up their notes for patient charts. Those times are so long gone. AI is rapidly taking over. We no longer need scribes because AI is writing clinical notes. AI is summarizing patient visits. AI is generating discharge instructions, as well as coding encounters for billing. And let's be honest, if AI takes that off your plate, most doctors would say, thank you. But here's the deeper issue. If AI removes 30 to 40% of your workload, do we still need the same number of doctors? That's where this conversation becomes real. So is AI now going to become the first point of care? Now imagine this. A patient wakes up with symptoms. Before they ever see a doctor, they go to an AI system. They input their symptoms, their history, their medications, and the AI tells them either stay home. AI tells them to go to urgent care or to go to the ER now. This is already happening. AI is becoming the first filter, the first evaluator, the first provider patients interact with. That changes access, but it also changes volume, because if AI filters out low-risk cases, fewer patients may ever reach a physician assistant, or even a nurse practitioner. Now, I know for some of us clinicians in different fields, this may sound very appealing. I don't know how many times we as clinicians have walked into a room to see a patient and thought to ourselves, oh my God, common sense is not common. Now, not trying to be mean, inconsiderate, callous, or unsympathetic, but I think every doctor, PA, and NP has been in this very place at some point or multiple points in our careers. Some of us still experience this every day. But this is an interesting point on several levels. While this may cut down on the number of visits, it also decreases demand for us clinicians in some cases. However, it can potentially decrease medical costs, medical waste, and improve quality of life for clinicians. But it can also take away the human element necessary in medicine when it comes to empathy, compassion, the need for a human hand, and a human heart. Some of these things can be lost when it comes to dealing with the use of AI. When we talk about medical cost and waste, the question will become, how much will AI cost organizations? I remember when hospitals started using the electronic medical record, Epic. You had to be a large hospital system to even afford the software. Still today, for some organizations, moving to Epic as their EMR is cost prohibitive. So is AI going to potentially pose this same problem, being too costly? This is yet to be seen. Interesting fact, I was just speaking with one of our respiratory therapists here at the hospital about the next podcast episode being about how AI is replacing doctors and clinicians. And she said, oh my God, in one of the ERs I work at, they have one ER doctor and the patients are being seen by some telehealth bot. There you go. AI is already here and has decreased the need for several ER doctors, where an ER can actually just have one ER doc. That's nearly unheard of. And especially in my days of training, one ER doc in even a small hospital was unimaginable. So now let's move on to chronic disease management without doctors. Let's talk about chronic care, diabetes, hypertension or high blood pressure, weight management. AI can now monitor glucose trends. We already have the continuous glucose monitors that record patients' blood sugars and send those results to their physicians electronically. AI can track blood pressure. AI can adjust recommendations. AI can also predict complications, all without a doctor physically present. Instead of come back in 3 months, it becomes your AI system is monitoring you in real time. That reduces office visits, physician involvement, and the traditional model of care. So in essence, as I stated earlier in the podcast, AI is changing medicine's landscape, and it's happening rapidly. There are some clinicians out there in the field who have no clue about the use of AI. I personally had no clue just how relevant AI had become in healthcare until I had that conversation with my colleague and began to do my own research. While AI has not yet found its way into many of the hospitals I work at, it has found its way into some smaller organizations who have had a tough time either recruiting doctors or just simply found that AI is the future and they're trying to get ahead of the game to change with the times. Now, let's be clear. There are things AI cannot replace. And as an OBGYN, I can tell you this firsthand. AI cannot sit with a patient in fear. AI cannot navigate uncertainty in high-risk situations or a high-risk delivery. AI cannot make judgment calls when everything is going wrong. AI cannot understand the human side of medicine and provide the human element that is necessary, so necessary sometimes. AI cannot provide the level of expertise necessary to know when something during a delivery is going wrong, like when a baby's shoulders get stuck in the birth canal after the head comes out, and how to rationalize the maneuvers necessary to deliver the baby. This is called a shoulder dystocia for those listeners who may not be familiar with that. AI also cannot provide the necessary expertise to bring a patient back to life after they die from something called an amniotic fluid embolism. I don't know that many of us, physicians, patients, or family members, would feel comfortable with a machine making a decision in a case such as this. Because medicine is not just data. It's emotion, it's risk, it's ethics, it's responsibility, it's expertise. In some fields, we use more than just our brain. We use our whole selves, our bodies, and our minds to keep patients safe. Not everything always fits neatly into an algorithm. So what's our real future? What's really happening? AI is not necessarily completely eliminating doctors. It's redefining what a doctor is, the doctor's role, and what a doctor does. We are moving toward fewer doctors doing routine work, and in some cases, fewer doctors in general in some fields. We're moving towards more doctors doing high-level decision-making. We're moving towards more reliance on technology. We're also moving towards more pressure to justify our roles. And here's the part that people don't say out loud. Some doctors will become less necessary in certain roles. That's not fear. That's reality. As I mentioned about AI's role in diagnostics, there may be less reliance on pathologists, radiologists, dermatologists. There could potentially be less reliance on the primary care doctor. With all of these specialties, just to name a few, their roles may change and the need to redefine their roles in medicine will likely be very necessary. Fields that rely heavily on diagnostic work will change. Areas of medicine that are procedure-based may be safe for now. However, I'm not sure if any of you have seen the first fully automated restaurant with robots for waiters and waitresses and even cooks. I saw that the other day on YouTube and was amazed at how these robots were sitting there flipping and stirring like Bobby Flay. It was incredible. Nowadays, you can even buy your own robot to help with tasks. I think the cheapest one I found was $20,000. That's not bad when some of us have personal assistants that we're paying upwards of $50,000 a year at minimum to do tasks that we have no time to do, like ordering a birthday cake for your 4-year-old. I know that sounds crazy, but some of our jobs are so demanding that we can't even do that and find the need to task that out to someone else. It's sad, but so very true. So to recap, no, AI is not fully replacing doctors per se, at least not for now. But it is replacing tasks, functions, entire pieces of what we've traditionally done. And the question isn't, will AI replace me? The question is, what part of my job is AI coming for next? Because the physicians who survive this shift will be the ones who understand that medicine is changing and evolve with it. The bigger question becomes is what specialties will have to evolve first? An even greater question is how will we have to evolve and how painful will that evolution be or need to be? What will we have to change to stay in the game and at the forefront of our fields? What will we need to do to keep our jobs and not end up jobless? What do we need to know about AI to help us with this transition? My daughter's preparing to apply to medical school, and while I really never wanted her to be an OBGYN, one of my conversations with her was to make sure she chooses a field where you cannot get rid of the human element, a field that is procedure-based. She thought about psychiatry since my son is a therapist. They had dreams of opening up their own office one day. Well, while my son may continue to be needed, I don't necessarily know with the role that psychiatrists play today in medicine if their jobs will one day be taken over by AI, seeing as many psychiatrists now function as prescription writers. So for all of those mentors out there who have mentees looking to go into medicine, or for those parents whose children are looking to go into medicine, this should prompt some thought, research, and discussion about their futures. And that is very integral in how medicine will look in the future. I'm Dr. Aisha Rush, and this is Informed and Unfiltered, where we uncover the truth about medicine, the good, the bad, and the ugly. If you found this helpful, make sure you like, subscribe, share, and stay tuned, because we're just getting started. You can also find me on my personal YouTube channel under Dr. Aisha Rush, where I talk about topics relating to obstetrics and gynecology. Be sure to like and subscribe there as well. There's always topics that are helpful for women and men alike on my channel. See you all soon.